The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
The baby boomers are getting older, and more women than ever before have entered their menopausal years. What are some ways to make the transition easier? Take a closer look at brain surgery. High technology is giving surgeons access to microspace. Prescription drugs and over-the-counter medications can be very effective if you take what you are supposed to take. Medication errors. What can you do to avoid them? Get the answers today on Today's Health.
The only thing constant in life is change, and what affects our health and well-being constantly evolves as we get older. For a woman, menopause is one of those times when her body changes and she can be confronted by a whole new succession of health problems. Hello, I'm Faith Daniels. Welcome to another edition of Today's Health. About 80% of women who reach menopause will experience disturbing symptoms triggered by the hormonal changes. In many cases, these symptoms are severe and intrusive. Fortunately, you have options to help you cope.
If you're a woman going through menopause, you're not alone. Every day, about 3,000 more women reach this stage in their lives. Currently, 30 million women in the United States have entered their menopausal years. That figure is expected to rise to 44 million women by the year 2000, when the baby boomer generation reaches their 50s.
Menopause actually has two meanings. One meaning is when a woman experiences her last period. But most of us feel that menopause is a transition from when a woman is capable of becoming pregnant to a point where she's not capable of becoming pregnant. Most women will experience menopause between the ages of 48 through 53. About 80% of all women will complain of hot flushes, the night sweats, even vaginal dryness. Osteoporosis is a thinning of bones that occurs with menopause in many women.
I would say menopause affected my life drastically. Probably the worst problem I had was dryness.
The symptoms of menopause are brought on by reduced production of hormones. A woman's body produces 3 sex hormones called estrogen, androgen, and progesterone, primarily in her ovaries. In the years before menopause, the ovaries begin to produce less and less of these hormones, and a woman's body often reacts to this loss.
Estrogen is the hormone that produces our femininity. That also is the hormone that's necessary for pregnancy to occur. Androgens have been associated with many positives: energy levels, with less fatigue, with helping estrogens in reducing hot flushes. Progesterone is the readiness hormone for pregnancy.
Hot flashes, night sweats, irritability, and other problems can interfere with your normal routine. When their intrusion begins to affect your quality of life, many doctors may recommend a treatment called hormone replacement therapy.
When we take hormone replacement therapy, what we're doing is we're giving the minimal amount of hormone that is necessary to prevent the problems that women experience when they lose these hormones at the time of menopause.
I went to my doctor to discuss replacement therapy. I had probably waited too long. I think I waited maybe 2-3 years before I went. I did that because I wasn't informed and I was really afraid of taking estrogen. But when I finally went and he discussed it with me, I decided that it is a better decision.
Menopause is not a sign of old age. Most women who reach this stage have over a third of their lives ahead of them, and successfully coping with the changes can make those years the best of their lives.
The Eastern cultures refer to the yin and the yang, meaning that the whole person is made up of opposite characteristics. We know that women produce testosterone and other hormones that used to be considered only male. What we don't know is how the loss of those androgens will affect each woman's menopause.
I was on an estrogen And since I wasn't, I was very dry, and they said the tissue was tearing. She suggested that I go on an estrogen with an androgen.
There is nothing more unique and complicated than the human body. No two are exactly alike, and the way any single individual reacts to physical and chemical changes is unpredictable.
If we look at the hot flushes, the night sweats, and the mood changes, probably about 20 to 25% of women will have severe menopausal symptoms, or the traditional menopausal symptoms that we associate with menopause. The usual way of treating women going through natural menopause is to start off with estrogen, and if they have a uterus, to include progesterone as well. Many times women who have experienced a surgical menopause need not only estrogen replacement, but androgen replacement. These women really experience more abrupt symptoms because they've totally lost, within the matter of 1 hour or however long the surgery takes, their estrogen, their progesterone, and their androgens.
Estrogen and progesterone replacement is a practice that's been fairly common for many years. Androgen has always been part of the female hormonal balance, but only recently have doctors begun to focus on it as an important element in hormone replacement therapy.
My patients tell me that when I bring up the word androgens or testosterone, they immediately think of growing a beard and losing their hair and becoming very masculine in their appearance. And I tell them, number one, all women produce androgens throughout their life. And number two, when we talk about androgen replacement therapy, we're talking about just that, what a woman would be producing herself naturally during the premenopausal years or before she had her ovaries removed by surgery. Many times women, as they go through menopause, or if they've had a surgical menopause and are put on estrogen, continue to have symptoms. And in these women, the addition of androgens is often recommended because androgens will alleviate these problems in many women.
No two women are the same. Menopause can make your life difficult or a breeze. What are some general coping strategies to minimize the symptoms and maximize your potential? Coming up next on Today's Health.
Pumping iron used to be the province of athletes and bodybuilders, but recently many women in their 50s started taking up weightlifting. It isn't the result of midlife wildness. It's one of the many things a woman can do to reduce menopausal symptoms and improve her overall health.
A woman, as she goes through menopause, should really be looking at it as another starting point in her life, and that it really is not an ending at all.
Menopause is both a physical and a psychological milestone in the aging process. For many women, this is a time of personal growth, when they make the necessary changes in their lives to become more fulfilled. The transition often includes a renewed commitment to their health.
It's very important for a woman to discuss all aspects of her health with her doctor. By discussing every aspect, the doctor and she can then decide what should be done on a preventive medicine basis as well as on an intervention medicine basis. In addition to hormone replacement therapy, most women have within their grasp lifestyle changes that they can make in their own lifestyle. For instance, increasing not only aerobic exercise, but weight-bearing exercise. Changes in their diet, low fat, high fiber, and adequate calcium.
I cut out almost all fat in my diet. I'm taking vitamins. My husband got me a treadmill so I could exercise.
All women should do some weight-bearing exercise because it's been shown to strengthen bone. She will increase bone formation.
Making changes in diet, exercise habits, and lifestyle may be all that some women need to handle the challenge of menopause, but that's not always the case. The symptoms brought on by a reduction of estrogen, progesterone, and androgen can often be unmanageable without medical help.
The most important aspect of communicating with a doctor is, number one, to discuss all aspects of the problems so that an individual program can be devised with the woman and her doctor regarding what's best for her. But unfortunately, there's still a reluctance on many women's parts to discuss a personal type of problem that they're experiencing, such as a sexual problem or a vaginal problem.
In one study, only 40% of women concerned about sexual problems raised that topic once they got to their doctor's office.
My advice to women would be to discuss every issue that you have regarding your health, especially as you go through the transition into the menopausal years.
I don't think I have a problem talking at all to a doctor or to anyone. It's your body and it's your life.
Some women may need hormone replacement therapy to feel whole again, and others may only have to make some lifestyle changes. There are many options available, and how a woman copes can be as individual as she is.
When it comes to health issues, there's so much to discuss and so little time to cover it all. If you want more information about any topic you see on this show, browse over to our website at www.vstar.com and we'll hotlink you right to the source. Navigating the contours of the brain may sound like something from a fantastic voyage, but to a neurosurgeon, it's an everyday challenge. Fortunately, today's brain surgeon is getting some very valuable assistance from high technology.
A brain tumor. Not many years ago, this was very grim news. Brain surgery has always been one of the most difficult and dangerous procedures in medicine. Many tumors are often considered inoperable because they are unreachable or too close to healthy tissue to avoid serious damage. Recent advances in microsurgery, however, have given neurosurgeons new tools to help navigate the tiny crevices through the brain and remove harmful tumors without destroying healthy tissue.
The brain is an organ which is made up of billions of cells which interact and control every other organ in the body. Successful microsurgery requires a combination of pinpoint precision and careful planning. Before the operation begins, it's critically important that the surgeon plan precisely the safest path to the tumor.
You are watching footage of an actual brain surgery in progress. The neurosurgeon is using the MKM system, which is a stereotactically guided surgical microscope developed by Carl Zeiss Incorporated. The technology allows the doctor to pre-plan every stage of the operation on a computer and have that information available in a heads-up display.
The benefit of having information available in a heads-up display is as important to the neurosurgeon performing the operation as it is to a fighter pilot. It allows you to keep your eyes on the operation without having to turn away.
Fortunately, there are several methods like an MRI or PET scan to help get an accurate three-dimensional view of the brain. That data can be fed into a personal computer, and a surgeon can perform many simulated surgeries to test the different pathway options. Once in actual surgery, the computer can indicate the selected pathway, and if the surgeon deviates from that path, a vector marks the way back. The more information that can be kept close at hand without having to interrupt the procedure, the better it is for the operation. Modern technology is no substitute for a gifted surgeon, but high-tech tools can help give them the assistance and the access they need to successfully operate in situations and spaces that were once considered inoperable.
Are modern medications getting better and safer? Who's looking out for us? And what about the human factor? What can you do to ensure the prescription you are given is the one you get? Next on Today's Health.
What not your prescription for hope. It may be a new drug or an innovative combination of older ones. Even if you only have a bug, the right medicine may help you get better. We often put our faith in medications, but how do we know that these medicines are reliable?
What's in your medicine cabinet? Well, if you're like many of us, there's probably quite a selection of over-the-counter and prescription medicines. Most of us take it for granted that if we follow the directions carefully, these medications are relatively safe, and they probably are. But do you know why?
I really don't believe that a patient should take a passive role in really anything pertaining to their health, and especially the medications that they're going to be taking.
Sometimes I do question the doctor as to his choice of drugs for me. The reason being is I know what my past experience with them has been, and I don't feel like I want to challenge him because he is the expert. However, I may know how that certain medicine reacts with me.
Patients or individuals, when you deal about health, don't really have to have medical degrees or medical backgrounds. You just have to ask the right questions.
Until the early 1900s, people had to take their chances with medications and unregulated remedies.
The government intervened in the early 1900s to establish the FDA, the Food Drug Administration. When we talk about drug therapy and health care, there's a lot of opportunities for human error to come into play. The more informed the patient is, the better, in a better position they are to assess whether or not a mistake is being made.
Doctors, nurses, and pharmacists are not the only information sources for the medications you may be taking. You can find current drug information from many resources, including the public library, bookstores, and the internet. This reference book describes medications in terms that a patient can understand. It is published by the voluntary, not-for-profit organization that sets the standards for drugs in the United States, the U.S. Pharmacopoeia, or USP.
I feel it is very appropriate to ask the doctor about the prescription, how it works, what to look for, and any other things to expect that might occur that I might not be ready for.
Medication errors can result as part of human error in that whole series of patient interaction with the healthcare system. So certainly an informed consumer is critical to the healthcare process.
In the pharmacy, many packages and labels look similar. Of the 10,000 brand names and 7,700 generic names, there are over 645 look-alike and sound-alike pairs of medications. Well, people make mistakes, but if you're informed, you may catch an error before it becomes a problem.
Between your doctor, pharmacist, and all the reference materials available, you could nearly drown in a sea of drug information. But don't let it intimidate you. You don't have to know it all. The key to being properly informed is understanding what you need to know.
Okay, Mrs. Smith. This should take care of your problem.
Tetracycline twice a day, benzodiazepine every 4 hours, amitriptyline every 6 hours or before bedtime, not with food except on Tuesdays or months ending in ER.
Got that? Good. Hope you feel better.
Now, this may be a bit of an exaggeration, but it's not unusual for patients to leave a doctor's office with prescriptions they can neither read, pronounce, or understand. If you feel this is happening, don't be afraid to stop the doctor and just ask.
Busy doctors' offices are commonplace nowadays. I think it's so important that people be educated about their conditions, that they ask the right questions, that they're not intimidated by the system. You know, what am I taking this for is basically the question that they should be asking.
Very often I feel like the doctor's too busy to ask about the prescription. Sometimes you even feel a little bit intimidated about it. Because he's the expert, you feel like you're questioning his judgment sometimes when you ask him these things.
Studies have shown that the better informed a patient is about the medicines he or she is taking, the better the outcome from the therapy. Some information available at your doctor's office or pharmacy can give you an idea of the questions you ought to ask.
Most importantly, patients should be asking questions on what should I expect from this drug? How should I take it? There's a lot of confusion on dosing. A doctor may write a prescription, take one every 8 hours, and what does that mean? Does that mean every 8 hours around the clock, or is it only every 8 hours while I'm awake? Or is it 3 times a day? When to take it? What happens if I skip a dose or I miss a dose? And so what do you do in that case? And those are some very reasonable questions to ask. Side effects, certainly. What symptoms should I expect to see that I don't already have? And then certainly, what symptoms should I expect to disappear with this medication? Any other questions that might come up as far as food or allergies. If you know you have an allergy, make sure that your physician and pharmacist know this.
I'm very concerned about the medications that are prescribed for me and for the children. The reason is because I want to know exactly what that is, what they can do, and what might be the harmful effects of that drug or that medication.
The more informed the patient is, the better informed they are, the better health care they will receive for themselves.
Usually when I get a prescription or the children get a prescription, I go to some sort of a reference book. And the reason is because it's going inside of me or the children. It's going to affect my body or theirs, and it would be nice to have an explanation of what is actually going to go on there, what are the side effects to worry about. If something were to happen, what should I do?
The FDA, USP, and other organizations that control drug quality can make sure they are standardized and predictable. But using them safely depends on an active partnership between the doctor, nurse, pharmacist, and you, the patient.
Our bodies are in a constant state of growth and change. New technology and better medications can help us live longer, but adapting to change with a positive outlook may be the key to living happier. For more information about any topic covered on our show, visit our internet website at www.vstar.com. I'm Faith Daniels. Join us again next time as we get right to the heart of matters affecting your life on Today's Health.
To purchase a complete written transcript or a videotape copy of this or any edition of Today's Health, write to this address or call 1-800-877-7769.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.